Thank you for tuning into my video. The video that I'm producing for you is to talk about the many changes coming in 2025 as it relates to Medicare Part D. The changes that we're going to see for 2025 are brought about because of the Inflation Reduction Act of 2022 that puts the changes in effect for next year. And there are some very significant changes coming for next year. The biggest being the elimination of the donut hole. If you've been on Medicare Part D for a while, and if you use a lot of prescription medications, you know what I mean by the donut hole, also called the coverage gap. Many people don't ever experience the coverage gap, and so these changes won't necessarily help them. But for the people that do experience the coverage gap or the donut hole, and that's about 15% of people on Medicare, that's a CMS or a Medicare number, the elimination of the donut hole will be a big deal for next year. We're going to see for the first time a cap of drug cost spending that's only $2,000. So for people who use lots of medications, for people that are used to the coverage gap and are frustrated when they reach the coverage gap and then are paying much higher prices for the prescriptions, for next year, the cap is $2,000 in out-of-pocket cost, and then when you reach that $2,000 cap, your drugs will literally be no charge. That $2,000 cap does include a $590 deductible, which is the standard model for next year. So next year's standard model is you have a $590 deductible. After the deductible, you'll pay 25% for your prescriptions, and your plan will pay 75%. And then when the total cost that you've spent on drug costs reaches the $2,000, from that point forward, going next year, you won't pay any, you will pay no more copays or costs for your prescription medications. So that's a big deal for people that use a lot of medications. And again, the government says about 15% of people on Medicare reach the coverage gap or the donut hole. On the other side of that, though, only about 5% of people ever get to the other side of the donut hole, and those people have very high drug usage. So these changes are good news for people that have a lot of high-cost prescriptions. On the other side, however, for the 85% of people on Medicare that have very low or maybe no prescription cost, or they just use a couple of low-cost medications, that they're not even using their plan for, there's going to be higher premiums and higher costs for the people in the 85% category. Because of the way insurance works, everybody pays into the pool and the claims are paid by the insurance company and the risk is spread out among all the people in the pool. Well, because of this low $2,000 limit for the high drug users, 85% of people not using it are going to fund the high users. So if you're in the 85% category, and chances are that 8.5 out of 10 of you are in that category, that you're going to see some changes next year that are going to be negative. The biggest being, we think, and we'll see significant premium increases on drug plans. Right now, you may be on a plan that has a 0 monthly premium or a $5 per month premium. We have several thousand people on those plans, and many of those people have very minimal prescription drug use. Maybe they use a couple generic medications, maybe they're not using any medications. So you may not be bothered by the fact that, hey, my premium is $5 or I don't have a premium. But next year, when the premium is increased by, say, up to $35, it'll be annoying to have to pay a premium, especially if you feel like you're not even using the plan and don't need the plan. In addition to higher premiums for next year, we also anticipate that the formularies or the list of drugs covered by your plan will be smaller and the copays may actually be higher. So we'll see higher premiums, maybe some medications that are covered this year that are not covered next year, or if they are covered, they may be a higher copay for next year than what they are for this year. If you get your Part D coverage from your Medicare Advantage plan for next year, We don't anticipate that there will be premiums increasing on Medicare Advantage plans if it's a zero monthly premium plan. And we do know those plans will still cover prescriptions next year, which is good news. However, we do think that many of the Medicare Advantage plans that include the Part D coverage will have a deductible for prescriptions where they may not have a deductible this year. A plan can have a deductible as high as $590, and we do feel like there will be plans that will have a $590 deductible. They may limit the deductible to only the name brand medications, but they of course could have a deductible for both name brand and generic medications. We also anticipate that for the name brand medications that are a tier 3 or higher, instead of being a fixed copay for the medication, you may actually have to pay a percentage of the cost instead of the fixed copay. So in some cases that could benefit you if you're on a prescription now that has a $40 or $45 or a $47 copay. You could end up paying 20 or 25% instead of the copay. By having the percentage, the price could fluctuate from month to month. You possibly could be paying less than what you're paying now, but there's also a good chance that you could be paying higher for your prescriptions that are a tier 3 or higher due to the fact that the insurance companies may, instead of having a fixed copay, actually have a percentage copay instead. So what if you decide that you think a Medicare Part D plan isn't worth the money next year? Maybe you don't have any medications, maybe you're using low-cost medications, maybe you're not using your plan, you're using a GoodRx card, or you're going to Walmart and getting a $4 prescription. What if you decide, hey, I don't want to pay $35 for a Part D plan next year, I don't want to spend the money? Well, certainly that's your prerogative, although we would warn or urge you to not do that. It would be risky to go without prescription coverage for a couple reasons. One, your prescription usage or coverage needs could change at any time. You could have some medical event throughout the year where now you need to be on a high-cost medication, and if you drop your drug coverage, then you would be on the hook to pay the full price for the medications until the following year when you can enroll in a new plan. So it would be risky to go without a prescription plan. The second issue would be if you decided to go without a plan, if later on in your life you decided to join a Medicare Part D during an open enrollment period, you would be faced with a penalty. The penalty is not a big number. The penalty is about 35 cents a month for every month that you went without a drug plan, but you have to pay that penalty every month for the rest of your life, and the penalty does get readjusted every year. So if you went 12 months without a plan and then signed up for a plan, you'd have a penalty of around $4 per month added onto your premium, and it would get recalculated every year. So because of the penalty, but mainly because of the fact that your prescription needs could change, we would not recommend you go without Medicare Part D coverage. One of the options you have if you don't want to pay for a Medicare Part D plan is to look at one of the many zero premium Medicare Advantage plans that are available that include drug coverage and do not have a premium. We're seeing Medicare Advantage plans gain more and more in popularity. I've got a video on that you could take a look at that says why that's happening. But certainly if you're a person thinking, I don't want to have to spend money on a Medicare Part D plan because I have low prescription usage, and maybe if you're irritated by the fact that your Medicare supplement keeps increasing in price every year, then you should take a look at the Medicare Advantage plans. We can help you with an analysis, we can make some plan recommendations for you, but that is one of the options that you have. Instead of paying for a standalone Part D plan, you enroll into a Medicare Advantage plan that includes the Part D built into it. In addition to the increasing cost for plans next year, we also are being notified or seeing that many of the insurance companies that offer Part D plans are not going to allow brokers to enroll members into those plans. And frankly, they're doing that because they don't have to pay a commission if they don't want to. And so we do feel like there will be plans next year that will be available to the general public that brokers will not be compensated and will not have access to the enrollment portals to enroll members into. If that happens with you, we certainly can make plan recommendations for you. We can give you advice and guidance and direction. and tell you how to enroll in the plan. But unfortunately, we will not be able to enroll you in the plan, nor would we be able to service the plan going forward. So just another one of the changes that we're anticipating for next year. We don't know which companies are going to choose that path, but we certainly are being told early that there are some companies that are not going to allow brokers to enroll members into their plans any longer, that you have to call that insurance company directly or go on Medicare.gov to enroll into a plan. So in summary, one of the most important things to take away from this discussion is that be prepared for your annual notice of coverage to show up in September, October this year. Be sure you open the mail, look at what the changes are, see what your new premium will be for next year, and then give us a call if you have concerns about that. And again, if you're thinking you don't want to pay for a Part D and you'd like us to do an analysis to look at Medicare Advantage plans, certainly give us a call or send us an email about that. We'll do an analysis for you, and we'll make a plan recommendation and let you decide whether you want to go down that path or not.